Okay, I guess we'll start. Good morning, everyone. My name is Mickey Nakamura. I serve on the PMO Global Alliance and partnering with the CIA as vice chair of our healthcare group. In my professional job, I'm a vice president of the EPMO for a national healthcare organization here in the US. And I'm very excited to be here with our esteemed panel of healthcare leaders from across the globe. And in our discussion today, we're going to be having some conversations talking about how COVID-19 has impacted technology, and not only technology, but how it's impacted people and process along with technology. I want to go ahead and introduce a number of people, but the first person I would like to introduce is Doug. Doug, would you like to introduce yourself to our panel?
Hi, everybody. I'm Dr. Doug Dickey, Chief Medical Officer of International Consulting for Oracle Cerner.
Thank you, Doug. Mohammed, would you like to introduce yourself?
Yes, thank you, Mickey. My name is Dr. Mohammed AlRayyes. I'm the lead physician executive for Cerner Oracle, looking after the Middle East and Africa region.
Thank you so much. Next I have for introductions is Sergio.
Hi, everybody. My name is Sergio Carmona, and I'm the lead physician executive for Oracle Cerner Canada.
Welcome, Sergio. And then last but not least, I have Elaine.
Thank you. Hello, everybody. And my name is Elaine O'Brien, and I work for Oracle Cerner as a health network strategy executive.
Thank you so much, Elaine. So thank you to our panel for joining us today in this conversation. We're going to be going through some questions and some topics here that I think would be very valuable for folks out there in the community. We're going to start with a topic and a question. And one of the things that we want to start our conversation off today is, can you share with us some of your experiences of how healthcare has changed during the COVID-19 pandemic, and not only technology-wise, but maybe go into some of the processes and people side as well. But this is a great question that we have out there. Mohammed, would you like to give us some feedback on your end? Can you share some of your experiences of how healthcare has changed during the COVID-19 pandemic? And it would be great to hear from your perspective some of what you have experienced.
Yeah, definitely. The pandemic has been a shock to all healthcare organizations across the world, a shock for all kinds of organizations, and a shock for everyone on this planet. And particularly for healthcare organizations, that pressure that came with the pandemic really required them to be as resilient as possible, to recoil and go back to operating because healthcare cannot stop. And for healthcare organizations, they needed to look at multiple aspects to make sure that they are ready, not only to face and combat the pandemic, but also to maintain the normal operations going, because people will not stop getting sick even during a pandemic. So honestly, it was really a demand and supply play that all of these changes were required to balance. Let me explain more here. We had the ongoing healthcare demand. We had the additional demand of the pandemic, but at the same time, the supply of resources, the supply of people, the supply of financials, all of that was under pressure to meet both the pandemic and the normal operations. And because of that imbalance, they had to look at other opportunities. They had to look at other areas that they can improve and to be able to recoil under this pressure of the pandemic. And this is where they try to become more resilient by relying on technology to some extent. So technology provided them with many options to deal with the new norm, or what was the pandemic norm that we had to deal with. So many healthcare organizations that were not fully digitized have immediately started their digitization process those that were already digitized, they went into deep investigation on how they can take advantage of that and move to the next step to be able to react to the pandemic. And that's where we saw all of the changes in the way healthcare is being delivered. We started seeing a lot of virtual delivery of healthcare, through whether that was through telemedicine, even in certain areas where it was not fully digitized, they even used phone calls just to make sure that operations are maintained and patients are being taken care of. Add on top of that, since we don't want patients to come into an environment that might put them at risk and contract that virus and become sick themselves, a lot of innovations has appeared during the period, especially at the beginning of the pandemic. If patients cannot come, then how are they going to get their medications? If patients cannot come, how are they going to do their tests? So a lot of innovations and great ideas there where we've seen many healthcare organizations creating medication delivery services. You speak to your physician through a telemedicine channel. They prescribe the medications for you, and suddenly the medications are at your doorstep. We've seen a lot of drive-through testing facilities across the Middle East region, and I believe across the world, to be able to continue catering for patients. We've seen a lot of pressure on, for example, emergency surgeries, elective surgeries, the balance between those. What can you postpone? What do you need to do now? And technology and data helped a lot in making the right decision, not only at the level of organizations, but also at the level of individual patients. A lot of shifts have happened during the pandemic, and hopefully the good ones, and many of them are really good, are here to stay.
Thank you so much for your insights. I think it is true that there has been some very profound changes and shifts that we've seen. I just had a kind of a added question, because you mentioned that the whole patient experience has changed. What have you observed? Because with the technology changes like telehealth, what are your observations from a patient perspective?
Well, to be honest, healthcare has been a little bit behind other industries when it comes to technology and utilizing technology. Patients or people in general, they had different expectations from other industries like banking, like even restaurants and food and beverages, compared to their expectations in healthcare. What the pandemic did was to sort of force patients to see that perhaps we can get the same type of service from healthcare. Perhaps we can use technology like we're using technology in other industries. And this is exactly what happened. So patient expectations became different. Healthcare organizations that had that competitive edge of providing telemedicine, of providing that convenience to their patients, regardless what kind of convenience it is, as I mentioned, your medication at your doorstep or driving through testing, patients saw this, okay, now this is very convenient, and that's what we are looking for. And I'm going to go to the healthcare organization that provides me exactly with that. So we shifted from an industry that's being led by the capabilities and the limitations of its individual organizations to an industry that's really being led by patient expectations, and those that risen up to the moment and the occasion are the ones that came out as winners. And there are known winners and losers in healthcare, but patients will always segregate or go give their business to the ones that bring to them quality of care, bring to them provide them with the right safety, and also that can now add that aspect of convenience to the services being provided.
Thank you so much. Thank you so much. And this is a perfect transition to my next question. Really, how does the integration of technology impact these new delivery models in healthcare? And then also, there's a second part to this. The IT side of technology or healthcare requires implementation. And how has this impacted project management in this new normal that we're talking about? So I'd like to invite Sergio to provide his observations.
Thank you, Miki. Yeah, as Mohammed was saying, the pandemic had an interesting effect on how we are delivering healthcare and how we're managing the different healthcare IT implementation of the different projects. In some cases, it slowed down things significantly because of the physical distancing restrictions. But in other cases, it had the opposite effect, where things had to be kept at a steady pace because we needed to provide proper care, and these implementations needed to move forward for that same reason. We had a number of clients that had implementations and go lives in the last 3 years. One in particular stands out. One single organization that had decided back in 2013 to go under one roof. 5 separate hospitals had decided that it was better to have a single source of truth for the project management, for the back office, supply chain, and project management functions, and they aligned under one single organization that was going to provide a single instance for the healthcare IT and the EHR solution. Now, these 5 organizations, as it usually happens, they were under hybrid workflows. They were on siloed EMR solution and paper-based as well. So the challenge was to bring them all together, establish a single governance structure, and have them align under this one roof. And unfortunately, by the time the contract with Oracle Cerner at the time was signed in 2019, they made significant progress in getting all these things aligned. So by the time when the pandemic struck in 2020, they had already made significant progress. And instead of saying we better slow down, they said no, we have to keep moving forward, right? Even though there was for some the virtual communication was seen as a barrier, they said no, let's use this as a mean to stay aligned and push forward. Other organizations and other providers felt that they had to slow down, but this particular organization say, in the case of COVID-19, it's not a barrier. We need to use this to keep moving forward. So they established virtual command centers and on-site command centers for the local support staff. And Cerner at the time provided a virtual command center, given the restrictions for traveling, even for the local teams located in Canada, as well as the US-based associates. So they held weekly script testing, weekly meetings, and in order to iron all the details out and sort out all the different issues that were rising. And they were in a pretty good place. So instead of postponing go lives, they moved forward, and the first organization went live in September 2020. A couple more followed suit in a couple months later, and the largest one followed suit in April 2021. So the clinicians and the organizations were ready, and they went forward. And they were able to leverage the technology to provide better care using these new EHR systems, despite the pandemic was in high heat, right? Now that doesn't mean that the work in these organizations is done. Like, they continue to optimize, and we have to revise how to improve things. But they were able to overcome the physical barriers, doing paper charting or being on siloed systems. They were able to jump and bridge that gap, so already providing better care. And we can see that other sites and other organizations are catching up right now as we are ramping back up, and some of the projects are proceeding forward and they're going live now as the measures are scaling down, right? But the virtual tools, like video conferencing, virtual collaboration tools have helped. And like Mohammed said, these tools are here to stay. Now we have to find the middle ground into how to keep the balance between in person and virtual or online communications. But these tools are here to stay, and they're helping moving these projects forward and keeping them at a steady pace.
And Mickey, I just want to add one more thing to that. Very interesting, the whole way we do training for doctors and nurses as well. It totally changed because of the pandemic. It used to be we would do at the elbow training at all times. And in actuality, now that we've gone through COVID, there's lots of doctors who choose, I much rather have virtual at my home at night to get trained versus, having someone come at the office or in the wards to train me. So it is quite interesting how that shifted as well.
Doug, you bring up a very, very good point. I've gone through a number of transformations myself on the EHR, EMR side, and you're spot on. Before the pandemic, a lot of our dress rehearsals, a lot of our, of course, our at the elbow support, everything from a command center, a lot of these were in person. And these were done, whether or not we had a town hall, these were in person. And, there's a lot of benefits to, of course, being in person and getting that kind of buy-in. But during the pandemic, there were really creative ways that emerged to bring in virtual teletraining, and even some of the town halls. We've done a number of these where they are a hybrid, right? You have folks that are on site, but you also have a team that's remote, and you're still able to get some good energy and some good rah, because you need to get people excited, right, for the change. But you have a very, very good point there that I think a lot of creative hybrid interactions happen during the pandemic, and I think a lot of them will be here to stay, is what I'm feeling. So
I'd just like to add that in our area, we actually brought projects live earlier in quite a number of places, because the problem of that we're trying to solve, if you tried doing it by the traditional workflows, they were actually just burning staff's hours. So the risk aversion that was there before suddenly shifted, because the risk of not doing something was actually greater than the risk of doing something. So there was a very much of a dynamic shift that was something that was really kind of, I don't know, it was liberating for people. And it's actually, some parts of that have remained about the assessment of risk, not doing something versus the risk of doing something. So that has been a really kind of very insightful, and those that saw that and took part of that remember and hold on to it, which I think is really good as well.
You bring up a really good point. Early on during the pandemic, we had not everyone, but we had a lot of people getting burned out, because that dividing line between personal and professional time, especially for folks that all of a sudden are now on Zoom or on Microsoft Teams, work-life balance wasn't there, at least for the first 6 months. People weren't even eating lunch or dinner, right? They were working. It hasn't improved since then. But any experiences from you all? I know it's not in our questions, but I think it's a very important topic, the change management side of projects, and the people, right? Our staff. Any comments from anyone on what you've experienced and maybe some things that have improved? I'm going to pick on you, Doug, because
all right, that's fine.
One of your areas.
I completely agree with you on the whole virtual idea of training and going live faster, and all of that just accelerated with COVID. There's no doubt. And why is that? Because I think we didn't think it would work, and we were forced to do it. All these organizations were forced to go live or forced to train or do something different like that. And all of a sudden, the great news is it actually worked, and they were pretty satisfied. And so it really changed the dynamic of where we're going in the future.
Could I pick up on the bit around staff? I think one of the learnings from our side in terms of looking after our staff, our associates, is that what we found is that they were working in a very concentrated way. Yeah. So if you think about the normal way that you would do things, so you take yourselves on site, spend time with people, then take yourself away from site and build stuff or whatever you had to do. But there was break in process, which gave people time to process what they were talking about or what they had to do. And in fact, that time gave people time to rest and to rest their minds. So what we found is that the day has become much more concentrated, but people haven't extended the day as much. So they kind of much more clear about the start and the end of their day, which I think is good and right, because what we've done is pushed people's productivity much higher, and that in itself can have quite a negative impact if it's not managed very carefully.
Thank you for sharing that. I experienced the same thing here in my footprint. We started encouraging staff to take breaks. We encouraged them to go walk around the block, to get out of the house, to get off of their chairs. And we started focusing on employee well-being because, to Doug's point, productivity went sky high for remote workers because they were actually quite productive. And I think all of us have been in that seat, but we also had to remind ourselves not to get burned out, right? Especially in healthcare. So thank you for allowing me to flex a little bit. And Elaine, I have a question for you. The question that we have for you is really, how has data been enabled in this new normal? And maybe go into some of your observations from your perspective.
Oh, thank you very much. Well, the perspective I'm going to mainly talk about is that of the English NHS. I work across UK and Ireland mainly. So the trend, but the trends that we're seeing here are not that different than throughout the rest of the world. There's just a little bit of differences of nuances, kind of depending on the maturity of the healthcare system. So generally, healthcare providers such as acute, mental health, GPs, communities and social cares are digitized. That's kind of the position we're in the UK, and electronics are kind of core for health and care delivery. However, they were very much silos of information, and that was making it very difficult to manage transitions of care for people from one venue to another. And therefore there was a gap in how to utilize the kind of the information about the person that was being cared for. So lots of little bits of information, partial piece of information. So through putting in kind of a digital capability that produced a linked data set, now that was available pre-COVID, but actually there was a fear around the use of it, or a reluctance because of very strong information governance challenges that were in our area, and I think that impacts in other places as well, particularly in the Nordics, etc. But the health and care staff professions had that capability. COVID was the game changer for them, because there's a little bit about, I was saying earlier, the risk of not doing something was actually bigger than the risk of doing something that was new and different. So that kind of broke through those IG barriers because they had to and wanted to do the right thing by the people they were responsible for. Now, what happened after that is then people saw the benefit of having that linked data set. And suddenly they had a much, much more complex and complete picture of an individual. And that also was a picture of what was happening in the population level. So what was happening in a local area of government, what was also happening in a region, and therefore the whole population. So suddenly there was a plethora of data for them to have a work through. So I'm going to just go through a couple of examples. During COVID, obviously we had the challenges of vaccine uptake. And if you looked at the high level number, actually AlRayyes were doing really, really well. But an example is in one of our clients in North Central London, they had a look at the data and they found that certain ethnic groups, their uptake was really very, very poor. So the data helped them to go identify the groups. So they looked at ethnicity and in those areas, there were two particular groups that were a bit challenging. Was the Somali community and also the Polish community as well. So what they then did on the back of the data is go and target engagement on the back of that. So they took those staff members who knew the community and went into their community, understood where they congregated, and it was usually in places where faith was celebrated. So then built out relationships with those faith leaders, and those faith leaders, along with health professionals, then were able to do the education about the requirements and the need for vaccines, and therefore that increased the uptake in those particular areas. So that's an example how data was used to find the problem, and then go back and find a solution to that, and then look at the data again to see if the intervention was having an impact. So that's been really, really good. Also, what's coming out as well is the role of the analysts and how important they are. So previously they were counting beans, and what they're now doing is, because we're automating the counting of beans process, that has meant that they're able to come out and look and explore the data. And what we're seeing our clients do is actually place the analyst into the multidisciplinary team. So they become part of the clinical intervention team and helping those staff understand the importance of data and how to use it and what they're seeing, and creating that consulting conversation about what's happening with their populations. So removing of that putting in automation, removing of that hard lifting has created capacity within the analysts and allowed them to start working at the top of their license as part of a multidisciplinary team. And they're identifying unwarranted variation and unmet need, and actually oversupply in the market where some groups are having more intervention than they should have. So that's kind of the things that I thought I'd like to share with you today.
You know, I love that point that you made on the result of automation enables capacity for people, namely you, in your example, the analyst, to do some more, probably a little bit more strategic types of endeavors, right, to be placed in this intervention team. And it sounds to me like this really gets them away from being the bean counters, like you mentioned earlier. But now they're in a position where they can see some solutions, right? Some proactive trends. And, you know, they're now being utilized in probably a more effective and meaningful role as opposed to just counting things, right? So I think that's a really good point that you made.
And I think it's two-dimensional. So there's a trade. So the analyst is able to upskill the clinical team in the function of analytics, and the clinical team are able to upskill the analyst to understand health and care better. So it actually means that everybody then shifts up and is able to deliver better health and care outcomes, really, I think.
That's a really great example. And that's happening, I suspect, not in just the analyst world, but that's occurring in other roles too, I think. So
100%.
Thank you for sharing. The other, as you're speaking, one of the other things that I wanted to ask you, and maybe this is for the whole team, is this concept of data, and I think you touched on it, Elaine, governance around the data. What are your perspectives on that? Because not every organization is mature from an organizational standpoint to have data governance, but any perspectives on that? Because I think that's a key capability or maturity item. Any comments on that from the team here?
Mohammed, you are the king on governance, so I would love to hear from you.
Well, again, as I said, in my answer to your question, the pandemic has really been a catalyst for a lot of change, and one of those changes was not only that healthcare organizations realized that, hey, we can use our data and get some insights out of our data, but also they opened up that box and a lot of things came out where, okay, now we have our data. What does our data really mean?
Yeah.
All right. How accurate is our data? How can we ensure that accuracy? How can we ensure that, looking at a national level, the information that I'm getting from organization A means the same thing as that one that I'm getting from organization B? And this is where a lot of conversations around data governance have emerged. Healthcare organizations, and let me be honest with you, healthcare organizations, when it comes to data governance, you would expect the opposite, but they're not as mature as other industries. Again, going back to the same point of the maturity of the healthcare industry in general. And now, perhaps a year after the pandemic, so a year and a half from today, we started having those conversations with different health organizations around the world. We started discussing with them the need to ensure that, first of all, you understand your data. Second, third, that whatever decisions we're going to make based on your data are going to be the right decisions. And this is where you build the entire structure of people coming together, defining their metrics, defining their KPIs, people coming together, coming up with that entire book or glossary or index of definitions of what does these terms mean in healthcare. And most importantly, because people got really interested in data and wanting to know more about their patients and wanting to know more about themselves as organizations, the issue of data privacy and data security has also became something that's really on top, really at the surface of every conversation that we are having. We see organizations now embarking on that journey. We see organizations that are establishing not only governance structures but also governance processes to ensure accuracy, ensure privacy, ensure security, and make sure that even the concept and the idea of the high probability of cyber attacks is really being tackled at the forefront of these organizations. But in addition to the data governance and how it's impacting the overall utilization of data in general, also it led us into more advanced utilization of data across the board in healthcare organizations. The pandemic being the catalyst, the opportunities that are being given to us by artificial intelligence and machine learning are things that organizations are really starting to pay attention to, and pay attention to in a way that, yeah, the pandemic forced us to do something, but this something that we've done right now, perhaps we can apply it to other areas within our operations. So let me give you an example there. During the pandemic, we worked with one of the healthcare organizations here in the Middle East to come up with a machine learning algorithm that will predict which of those COVID patients walking into our emergency department are more likely to be admitted to the ICU. So that will require more intensive care. And it worked really well because it was based on their data, based on the population that they serve. Now that the pandemic is, I don't want to say that it's gone, but it's having less impact. We are starting to see them using those tools and those machine learning algorithms to decide if any patient walks into our AD department, what is the likelihood of them requiring an admission in general or an intensive care admission. So all of that really was initiated by the pandemic, and we see a lot of those advances happening right now.
Thanks so much, Mohammed. I think this can be maybe perhaps our next session. It is such a deep topic, and it's one of those topics that lives beyond the pandemic. But that kind of takes me to our last discussion point here. I just wanted to open up to all of you and really thank you for all of your insights. But I'd like to spend a few minutes here just to ask you, what are your perspectives and reflections on what do you think will stay with us even after the COVID-19 pandemic eases, and what do you think will perhaps not be done? But I want to focus on the near future here. What do you think will stay with us from all this innovation, all this new ways of working, all of these new technology catalysts that have occurred? Maybe I'll just go around the room, but maybe Sergio, any insights from your end on this? What do you think will stay as part of all this innovation?
I think we can see it happening already. Particularly here in Canada, we have a big landmass to cover for the different projects across the different regions. I think we are coming to a point where we can weigh in and see if it's worth bringing resources on site for project management, for go live support, for training, right? And as Doug was saying, for a lot of clients in a lot of organizations, the virtual modality is working, right? Both for the actual end users as the actual trainers or the project staff. Definitely, it's worth assessing if it's really necessary. For some projects, it's really necessary to have on-site teams and show up and establish an on-site workforce. But we, as you were saying yourself, Mickey, it's the productivity has jumped. We've seen that teams can work remotely and get things done. Sometimes even better than they were doing before. So I think the virtual conferencing, the online working tools, collaboration tools are here to stay, and they only get better with time. With the need and with the way the technology is progressing, I think they're gonna get better. So yeah, that's at least what I can say from this side of the globe.
Thank you. Thanks so much. Elaine, any comments from you? Because what I like about our panel here is we reflect from different regions across the globe. So any perspectives on your own?
So I've got it's from quite a different perspective. So I think persons' engagement in their healthcare is different now. They are using technology in a way that they have never used it before. Mm-hmm. From our perspective here in the UK, is they now have access to a single NHS app for their healthcare. and they have utilized that for the vaccine program and their vaccine pass, their COVID vaccine pass. And that's made them go onto that platform in a way that's never happened before. And if we are clever, we will continue putting information into that is useful for them to continue interacting with healthcare in a much much more holistic digital manner. So that I think will stay, and that would be really exciting, and I think that's good. And that opens up then the opportunity for them to have automated messaging, education, all of those things that can be done that then take away the heavy lifting from health and care professionals. That creates opportunity for them to be able to work at the top of their license. So that's a big ask, and it's got some way to go on that. The problem with that is about digital exclusion. And so therefore we do need to continue to have methods to interact with people who just do not want to interact with digital. And so we can't take things away. And the last thing I wanted to talk about was the networking of people. So the worry is that we don't get back into the real world. And that's a real negative, because the energy we get from spending time with each other and just being humans beside each other is really quite important. And I don't know what the balance is yet, but it can't be not. I know that for a fact. But that would be my observation. And I think sometimes us folk in the digital world are more likely to stay in our homes if we get the chance and be out networking. And I'm making a very sweeping statement, but I just think that's important as well.
I was going to offer that as one of my takeaways after listening to you all. But since you brought it up, I think the human connection, regardless of the pandemic or not, if anything, the pandemic made us realize no matter how technology has advanced, the human connection is still something that's going to be key and stay. With AI and whatever, the metaverse, right? All kinds of different technological advances. But at the end of the day, it comes down to us humans and our patients. And, that's something that will stay, regardless of how advanced we get in IT. And that human connection, Elaine, I saw it last week. We had one of our first in-person events for a particular leadership group, and people were just hugging each other. People were like missing that human touch, right? Because they've been in Zoom and virtual worlds for a long time now. Now, granted, all of us have done periods where we go on, of course, but in a sustained setting. That we will start doing as soon as COVID-19 goes. Mohammed and Doug, any final comments from you? Maybe I'll start with Mohammed, and Doug, I'm going to save you for last. So, Mohammed, any quick perspectives you might have on what do you think will stay?
Well, honestly, I believe all of the technological advancements will stay, but it's just a matter of balance, right?
Yeah.
What will stay and what dosage? What will stay for how long, and what will stay with such an impact? We were forced, and then again, going back to the virtual care and telemedicine example, we were forced to do that at the beginning. But perhaps unlike many other industries, healthcare should be always high touch versus high tech in terms of care and what we provide to our patients. That personal touch will need to be there, and it's very difficult for that personal touch in healthcare to come across a screen and a mic. That's very difficult, and I still believe that we will continue to have telemedicine as part of what we are doing. Mm-hmm. It helps a lot in managing the costs. It helps a lot in managing the accessibility of healthcare, but it won't be the single method of delivering care. People perhaps will go to the extreme and then come back to that sweet spot, to that point where everything is balanced. When it comes to the utilization of data, the artificial intelligence, the capabilities in there, and the limitless potential I think that's gonna continue to grow and gonna continue to improve. Not to get to a point where we're gonna replace physicians with AI algorithm. That's not gonna happen. But perhaps we're gonna have more tech savvy, more physicians that know how to work with AI at their side, helping them to make better decisions rather than computers really solving our clinical issues. So yeah, I think we will reach a balance at a certain point in time in the upcoming years, and otherwise the overall picture looks very hopeful. Many giant tech companies are getting into the healthcare industry to take advantage of that, and it looks really optimistic.
Thank you so much. And Doug, there's a reason I saved you for last, because I think you pointed out some really higher, broader trends. But any perspectives on your end?
Yeah, well, first of all, I thought the team did a great job answering that question, so I don't really need to add more there. But I do want to talk about the future, longer term. Let's say this decade, because I really think that this decade is going to be the big change. And what I mean by that, for the first 50 years of using technology in healthcare, we have basically tried to reproduce paper processes, and we put a lot of data in without really getting the benefits out. And I do believe this next generation or this next decade is going to be the difference there. Why? Because I do think all the systems become much more interoperable, number one. Number two, everything moves to the cloud in a safe way, so that it's still the patient's or person's data, but it is there if they need it. As long as that patient gives permission, anyone else can see it because everything's connected. And then we start using this machine learning and AI that Mohammed was talking about to then start predicting problems with health before they even occur. So can you imagine, let's say, predicting congestive heart failure 6 months before they even have a symptom? That's what's going to happen in this next 10 years for sure. Because all these things are going to be working together. Big tech's now getting in there. We have big data. Everything's in the cloud. It's starting to analyze. And so, again, there is no replacement for the human touch and the human experience, but it will be those tools that will help the clinician to help make those decisions and get better outcomes for our patients.
Thank you so much. And I think all of us agree with you that the possibilities are almost endless in terms of the future. And it's quite interesting. It was made, there was a couple comments here about how the COVID-19 pandemic was really a catalyst for us to accelerate on some of these ideas. Some of these ideas in other industries are not ideas, they're actually in place. But because of the COVID-19 pandemic, if you want to look at the silver lining, is it accelerated digital in healthcare, and it accelerated it in such a way that we were able to still provide patient care when it was needed most, right? And we're still all living that right now. But really, really great conversations here. I want to thank you all for joining us today and offering your insights. I want to thank PMO Global Alliance. I want to thank ASEA, who has been our leader over this and keeping us all together. And it's been an honor and a pleasure to have this discussion with you all. And I look forward to some more discussions. I think we touched upon a lot of topics for maybe future conversations.